Good day, ma'am. I am James Luis Gomez, your student nurse for today. And now, we will be conduct your body temperature or your vital signs. So, first, for the purpose of this, ma'am, to establish baseline data for subsequent evaluation. And this is also to identify whether the core temperature is within normal range and to determine changes in the core temperature in response to specific therapies. And also, lastly, to monitor clients at risk for imbalanced body temperature. So, things must be needed, ma'am. We have here a thermometer, a stethoscope, and sphygmomanometer. And in assessing the thermometer or using thermometer, we have five thermometer placements. We have oral, rectal, axillary, tympanic, and temporal artery. So, first, ma'am, we need for the procedure. Of course, can I know your name, ma'am?
I'm Christine Abalos.
Okay, ma'am. Date of birth?
December 22, 2000.
Alright. So, the first thing we need to do is, of course, perform hand hygiene. And after that, always remember keep the security of the patient or the privacy of the patient. If there's open window or open door, make sure that to close it. And of course, ma'am, for today, ma'am, I will checking your vital signs. It is important for us to know if there is any problem with your health condition or if there's no problem at all. So, ma'am, vital signs consist of four elements. So, the first one is blood pressure, which is the temperature, the pulse rate, and respiratory rate. So, we are also considering the pain as a vital sign because the evaluation of pain became requirement of proper patient care as important as the basic assessment. So, may I ask you some question, ma'am?
Sure.
Alright. What is your pain scale from 0 for having no pain or 10 for having severe pain?
0, having no pain.
Oh, nice. That's really nice to hear, ma'am. So, first one, I'll be checking your temperature. So, first thing we need to do is look for the thermometer. And wipe it and make sure this is clean before you use it. So, ma'am, I want you to put this on your armpit. Okay. So, after that, we need to wait at least 1 minute to have the result of the body temperature measurement. So, to give you some information, ma'am, the normal temperature, ma'am, is between 36.1 degrees Celsius and 37.2 degrees Celsius. Then let's wait for 1 minute to have the result. Alright, I think that's the... Okay. I'll take note of that. So, ma'am, our findings is your vital signs for the body temperature is 36.2 degrees Celsius, which is normal range, ma'am. So now we will proceed or we will conduct your peripheral pulse rate. So, ma'am, for the purpose of this is to establish baseline data for subsequent evaluation, to identify whether the pulse rate is within normal range, to identify the pulse volume and whether the pulse rhythm is regular, to determine the equality of corresponding peripheral pulses on each side of the body, and to monitor and assess changes in the client's health status. Also, to monitor clients at risk for pulse alterations, and lastly, to evaluate blood perfusion to extremities. So, ma'am, uh, so let's, of course, do not forget to perform hand hygiene. Ma'am, can I have your hand, please? So, in this one, I need to locate and palpate the mm, two fingers on the moderate pressure. So, like this one, I need to do this at least 1 minute to count the rhythm and volume. After that, of course, we need to document it after. So, at least 1 minute now. Okay, ma'am. So, after that, document the pulse rate, rhythm, and volume. Also record the pertinent related data such as variation in pulse rate compared to normal for the patient and abnormal skin temperature. So, we have different procedure in assessing the pulse rate. The first one is radial, which is what we perform now. And the second one is the bronchial, carotid, femoral, popliteal, posterior tibial, and dorsalis pedis. So, ma'am, based on our findings, your pulse rate is 86 and it is normal. So now, let's proceed and conduct your respiratory rate, ma'am. So for the purpose of this, ma'am, fundamental vital sign that is sensitive to different pathological condition like adverse cardiac events, pneumonia, and clinical deterioration. So, ma'am, like what I did before earlier, I need to do the radial, what we performed before. So, can I have your hand, please, ma'am? Same goes in the first procedure what we did. I need to put my palm and my on his bronchial, or rather is, yeah, like this one. We need to palpate it at least 60 seconds or 1 minute. So, while palpate this, you need to observe the depth, rhythm, and the character of respirations. Okay, ma'am. I'll take note of that. So, ma'am, your respiratory rate is 17 and it is normal. So now, after that, ma'am, we will need to conduct the apical pulse rate. So, for the purpose of this, ma'am, to obtain the heart rate of an adult within an regular peripheral pulse, and also to establish baseline data for subsequent evaluation. And lastly is to monitor clients with cardiac, pulmonary, or renal disease, and those receiving medication to improve heart action. So for assessment, to assess clinical signs of cardiovascular alterations such as fatigue, weakness, pallor, cyanosis, and palpitations rather. So the first one we need to do is position the client appropriately in a comfortable supine position or sitting position. Expose the area of the chest over the apex of the heart, and now I need to locate the apical impulse. This is to a point the apex like this one here, and where the apical pulse can be most clearly heard. Okay, here, so palpate the angle of Lewis. This is the angle between the manubrium and the tip of the sternum and the body of the sternum. And after that, slide your index finger just to the left sternum and palpate the second intercostal space. This is your second intercostal space, ma'am. And place the middle finger next to the finger on the third intercostal space and continue palpating downward until you locate the fifth intercostal space. Okay, so move the index finger laterally along the fifth intercostal space forward, the MCL in this case. Okay, ma'am, I want you to sit straight, and after that, escalate and count the heartbeats. Okay, they help in the develop and maintenance of the female sex trait, as well as the fertility, pregnancy, and menstrual cycle, reproductive hormones, and important in the development of both male and female reproductive system, as well as their growth and sexual characteristics. So after that, we need to use stethoscope. Make sure that to use antiseptic wipes to clean the earpiece and diaphragm of the stethoscope, like this one. Of course, the earpiece. Insert the earpiece of the stethoscope into your ears and in the direction of the ear canals and or slightly forward. So place the diaphragm of the stethoscope over the apical impulse to listen for the S1 or S2 sounds, which are the lub dub lub dub lub dub. So the rationale for that, the heartbeat is normally loudest over the apex of the heart, and each lub dub is counted as one heartbeat. If the rhythm is regular, count the heartbeats for 30 seconds and multiply by 2. If the rhythm is irregular, or for giving certain medications such as Lygocin, count the beats for 60 seconds. Okay, assess the rhythm and strength of the heartbeat. So after that, I need to document the pulse rate and the rhythm. So, ma'am, your findings of your apical pulse rate is 82 beats per minute. It means it is normal. So now, I need to proceed to or conduct the apical radial pulse rate. So, for the purpose of this is to determine adequacy of peripheral circulation or presence of the pulse deficit. So, for the assessment of this is clinical signs of hypovolemic shock will includes hypotension, pallor, cyanosis, and cold, clammy skin. So for the procedure, I need again to locate your apical and radial pulse rate. And now I'm just one. Now because I'm just one nurse, I will do the apical impulse by stethoscope first. So, ma'am, I want you to sit straight. So, in assessing this, we need at least 60 seconds or 1 minute to observe the heartbeat and assess the apical rate and if the heartbeat is strong or weak. Okay. So after getting the apical impulse, we need to, of course, palpate the radial pulse now. Then same goes with the apical. We need 60 seconds to count the heartbeat. So we need to palpate it and count 60 seconds using the clock. 1, 2, 3. So assess the apical radial pulse rate. Also assess the radial pulse rate rhythm and volume. Okay, ma'am. So I need to take note of that. After getting the apical rate and radial pulse, I need to record it, ma'am, because such as variation in pulse rate compared to normal for the client and other pertinent observations such as pallor, cyanosis rather, or dyspnea. So your findings, ma'am, your apical radial pulse is 91 beats per minute and the findings is normal. So now for the last one, we need to conduct or to assess the respiration. So first, what is the purpose of this? For the purpose of this, to acquire baseline data against which future measurements can be compared, and to monitor abnormal respiration and respiratory patterns and identify changes. To monitor respiration before or after the administration of a general anesthetic or any medication that influence the respiration. And lastly, to monitor clients at risk for respiratory alternations. So, for the assessment of this, ma'am, we assess the skin and mucous membrane color, position assumed for breathing, signs of lack of oxygen to brain like irritability, restlessness, drowsiness, and loss of consciousness. So, more than that, we assess the chest movement, activity tolerance, chest pain, medication affecting respiratory rate, and lastly is history of pulmonary condition, smoking, exposure to toxic fumes, and living with others who smokes as well. So for the procedure, first, for a routine assessment of respiration, determine the client of activity schedule and choose the suitable time to monitor the respirations. So if the client has been exercising, will need to rest for a few minutes to permit to accelerated respiratory rate to return to normal. So, ma'am, I need you to sit straight, please. And so after that, the client's awareness that the nurse is counting the respiratory the client to purposely alter the respiration pattern. If anticipate this, place the hand against the client chest and feel the chest movements breathing. Place the client's arm across the chest and observe the chest. Ma'am, I want you to cross your hand like yes, like that one. And we'll suppose you take in the radial pulse. So after that, count the respiratory rate for 30 seconds. If the are irregular, count for 60 seconds if they are irregular. So after that, ma'am, I want you to inhale and exhale. So 1, 2, 3, inhale, exhale, inhale, exhale, inhale, exhale. So after that, observe the respiration of regular or irregular rhythm. The rationale of this is normally respirations are evenly spaced. So after that, observe the character of respiration by the sounds of produce, the effort they require. So the rationale of this, normally respiration are silent and effortless. So I need to take off that, to take